Just wait for some people to join the live. In today's live, I will be discussing with you about recovering from a cesarean section. So, what are the things that happen during a cesarean section, like immediately after, from the process of the time you are in hospital to getting home, to what you can do to also help, with your recovery, and things that other people can help you with, and just giving you some tips on what to expect and things that you can do to make the process easy as possible. I've got my laptop here, so if you see me looking down, because I've got some notes and I like to just make sure that I go through all the notes so I don't miss anything out. So today we're going to be talking about recovering from C-section. My name is Gifty. I'm a midwife based in the United Kingdom. Thank you to all the new subscribers that have joined my channel. If you haven't subscribed yet, then please do well to support me by subscribing and also sharing the videos to anybody that you feel will benefit from the information that I give on this channel. And thank you for all the new subscribers. If you're already subscribed and you're here, thank you very much. And if you are new and not yet subscribed, then I hope that you will subscribe to the channel at some point during this live or later on when you find my video interesting or informative or entertaining for you. Thank you so much. So with cesarean sections, I'm not going to go into details of why you will need a cesarean section or like, I'm not going to do that. I'm just going to discuss exactly what you need to do and how it's like and the support that you may need, or how you can do things to better have a recovery that is not so stressful. So initially, when you've had a cesarean section at the hospital, what's going to happen straight away is that you'll be taken to a recovery area for you to be looked after very intensely, to make sure that everything that was done in the theater is okay, and you're going to have your vital signs all checked very, very closely. Okay, so once you've come out of theater, you'll be taken to a recovery room and you'll be intensely monitored. You will be transferred with a midwife as well as your anesthetist that was looking after you during the surgery, and that person is going to be the one that's connecting you back to all the machines to make sure that all your vitals are being monitored closely. And what the anesthetist is going to do is to make sure that you're okay, and they're going to give a handover to the midwife in recovery, as well as your midwife that was with you in theater is also going to give a handover to the recovery midwife as well, and they're going to be looking after you to make sure that everything is going well. So if there is any concerns, you will have quite a few people around you to make sure that nothing is missed and you are closely monitored. Okay. The feeling of following your cesarean section, you're going to become a bit groggy. Okay, so you're going to be a little bit sleepy. You're going to have some form of confusion and not so fully alert per se, which is all normal. Okay, nothing is wrong with that. It's quite a normal sensation to feel. You may also feel maybe a bit of pain. You will definitely have some numbness because, of course, with the epidural that they give you in order to have a cesarean section, you will be numbed from your abdomen down. So therefore, you are not going to be feeling any sensation in your legs yet. Even if you did, you will have very, very minimal sensation in your legs when you are being told to lift your leg or wiggle your toes. You might just be about to be able to do just wiggling of your toes. And at this point, this is very normal. You also need to bear in mind that you will have some things connected to you. At some point, you want to maybe feed your baby, but as long as all your vital signs are okay and they're not worried about it, they'll be able to get to that after not a long time. Okay, so once your vitals are all okay, you will also notice that you will have a catheter inserted, okay, in the urethra to help you to pass urine. Because, like I said, you're going to be numb from the stomach down, so you're not going to have the sensation of needing to go toilet. And it's very, very important that your bladder is not overworked and is not stretched and is taken care of. So you're going to have a catheter inserted just before your operation, and then you're going to have it in there for at least a minimum of up to 6 hours. But initially, you're not going to, it's not going to worry you, it's not going to bother you, and that's okay. So you're going to have a catheter inserted, going through to empty your bladder very well and consistently. And then um, you're also going to have some IV fluids lines going. You're going to be hearing a lot of noises in the room that you're in, which recovery. You may be with other patients, and there'll be other midwives around looking after the other patients. So there'll be a lot of noise, a lot of beeping sounds. If you've never been there before, it is a little bit daunting when you are put in there, but it's absolutely safe. You're fine, and this is normal. Okay, so if you are feeling like everything is really scary, or everything is out of context, is absolutely normal. You're going to have somebody there all the time. They're going to be giving you your buzzer to call for help if you are ever concerned or anything like that. The recovery midwife is not going to be very far away from you at all. They're always going to be nearby. Okay, and you are going to be feeling a sensation of not sure of what is happening, and also the sensation that you cannot move your legs might be a little bit scary at first, but rest assured that it is okay. You are going to be going to get the feeling back in your legs in due course, but it is quite scary at times as well for some patients when they feel like, oh, I can't feel my legs, or I can't move my legs. And this is normal, okay? This is absolutely normal. However, whilst you are doing your recovery and you're being looked after, the first aim for us during recovery is to make sure that you are, number one, your vitals are all okay at some point. There was no issues, no concerns, and at least the first 1 hour is gone smoothly. Everything is okay, and your midwives are happy with you, and they are keen for you to start doing other things, such as maybe having some water to be given to you to make sure that you can drink water okay. And then later on, they're going to move on to giving you some light meals, maybe like a toast, to make sure that you can eat okay and everything is all right with your systems. Your doctor, or the consultant, or whoever that has done the operation, the surgeon, is going to come in also and speak to you and tell you how the operation went. If there was any concerns or any worries or anything that they need to tell you about, they're going to come and do at this point. You will have your partner with you. Whoever was your birthing partner who was in theater with you is going to be with you as well in recovery, okay? As well as, of course, your baby. So you are not going to be alone in terms of for support. You're going to have your birthing partner with you, and whoever came into theater with you, whether it's your husband, your mother, your relative, or anything like that, whoever was with you in theater is going to go along with you as well in theater into recovery. So don't worry about being alone, or that nobody's around you. In terms of the post-surgery pain, once you start to feel like you can move your legs, and you've had your water, you've had some food, and you are able to at least move your legs a lot more, you're going to be asked to be moved to a postnatal ward. So once everything is okay, your vitals are all stable, and the recovery midwives are happy with your recovery, the doctors have seen you, they've spoken to you, the anaesthetist has reviewed you, and everything is okay, they're going to make a plan to move you to a postnatal ward. Now, on this ward, you're going to be joined to a much larger environment of more people there. Possibly, maybe you're going to be put into a bay or fall to a bay with an ensuite toilet that you can use later on. And then you're going to be given a jug with water, as well as a cup. You will be given time to try and hydrate as much as possible. in order for you to be able to get your bladder works going, so that your catheter can continue to drain and empty the bladder and all of that kind of stuff. So definitely you're going to be advised to keep hydrated. You've had some food, and then from then on your midwife will be helping you with caring for the baby as well. So you are going to be, if you are planning on breastfeeding, then the midwife will be helping you to try and breastfeed, whether it's to help you with positioning and attachment, latching the baby, and just supporting you with breastfeeding. Now, remember, once you've had a cesarean section, it's going to be very difficult for you to move yourself about. Let's say if your baby's in a cot next to you, you're not going to be, finding it very easy to just pick up the baby and feed baby and put baby back. Okay. So you're going to need some support doing this, especially to put the baby back in their cot. We're not recommending for you to sleep with the baby in your bed at all. So, of course, you have to make sure the baby goes back into the cot next to you. If your partner is there, this is their job for them to help you move baby to you and then get baby back to their cot when you finish breastfeeding. If your partner is not there at this point, you can always call up with your call bell and somebody will attend to you, whether it's a support worker or your midwife will attend to you and support you with whatever you need support with. Okay. So in terms of support, you have your partner, you have your midwife, you also have some health care assistants to support, or sometimes you have breastfeeding support workers. Some hospitals also have some volunteers that are there to support the mothers, and also just to be a companion and all of that kind of things as well. And then when it comes to 6 hours post your cesarean section, you're going to be advised to try to get your catheter removed, and then you're going to be advised to try and walk around. Okay, so you're not going to be expected to walk a really long distance, but at least to be able to come out of the bed, walk around, whether it's in the room that you're in, you're going to walk around in there, or you're going to try and walk down a corridor and come back to your bed. That is going to be very, very important for you to be able to do at least after 6 hours. It's vital that you are moving about. Okay, it's very, very important that you move about during this time when we are asking you to try and mobilize. You can get support to do this either through your partner to hold your hand to help you along, and you're going to do really gentle steps and all of that kind of small little movements to help you to to walk. Walking is very important because it's going to help you to keep your circulation going and to avoid any blood clots. Okay, it's very, very important that you move when the time comes for you to move, because it's very, very important that you do not stay in bed, and this can promote the reduction of any clotting at all. Okay, you're going to have things like a compression socks on your legs to help with your circulation, because you're not going to be moving quite a lot as we would as you would normally like to. It's very important that we give you these compression socks to help the circulation in the legs to keep moving, okay, for your blood to keep circulating around properly to avoid any blood clots. So please remember this, that if you are being told to walk after your cesarean section, is very, very normal and is a good thing to do. So don't shy away from trying to walk, or the sooner you can walk when the time is right, the better your recovery will be, and also you're going to feel much better, and you'll be able to then start on the road to recovery and then to get in discharged from the hospital to go home. Okay. When it comes to caring for the wound, when you are in hospital, the midwives will be checking that the wound is not bleeding through the dressing. They'll make sure that the dressing is neat and is clean. You might be in hospital, let's say, for about at least a night or two, depending on how things went and how you are doing, how baby's doing as well. So after your cesarean section, expect to be in hospital at least one night. You're not going to have a cesarean section and then go home on the same day. So if you were keen to say, look, I want to go back to my other child at home, then please bear in mind that this is most likely not going to be possible. You need to be in there for them, the health professionals, to check and make sure that everything is going well before they will be able to discharge you home. So at least one night is expected. Most of the time you're going to be in hospital for at least 2 days, and then they'll, this will confirm that everything is okay, baby's fine, you are, feeding baby, and breastfeeding is off to a good start, if that's what you choose to do. Or if you are going to be formula feeding, that you've got the hang of it, you're walking well, you are coping okay before they send you home. So at least expect to sleep in the hospital at least a night or two. Okay. So let me move on to, let's say you've now recovered really well. You've got your catheter removed after the 6 hours. You spend your first night in the hospital. Everything is going well. You are now feeling like you can move a lot more. You're going to be well medicated in terms of pain relief, okay? Because when you're having your cesarean section, you're given a lot of high dose medications to help you with pain management. So once you're in recovery to come into the ward for postnatal care, you're going to be well managed in terms of your pain relief. Now, it's very, very important that before you even come in and you've had your cesarean section, that you are having this thought in your mind that you're going to maintain this pain relief that they give you in hospital, or the same level or the same timings that they've been giving you, that you're going to carry on with this at home. This is going to help you to recover better and to maintain a good enough, strength to carry on looking after your baby and to also look after yourself as well. So you've now, been checked out, you are good, and they've now informed you that you're good to go. So you are able to go home and you're going to get discharged. Okay? You're going to be given all your tablets to take home, which is known as a TTA. So they're going to be giving you all your medications to take home. They're going to give you all the advice, the instructions of what to do in terms of caring for the wound, looking after yourself, what's normal, what is not normal, what is concerning, what you have to do if you're concerned, how to refer yourself back to the hospital if there's any emergencies, whether with yourself or the baby. And they're also going to give you a discharge summary. This summary is going to include all the information about the birth, about yourself in terms of your blood loss, baby's weight, time of birth, time of, the whole lot with everything that's involved within the delivery. You're going to take this away, and they're also going to give you additional information such as how to register your baby's birth. So you're going to have, a pack. Normally it's in an envelope that has all the information that you need regarding your registration of the baby's birth, um, and all other important things like, contact numbers for your community midwives, things that you're supposed to have, or things that you to look out for. All of this will be in an information pack for you to take home. So you may not know of it yet, but it's very, very important that somebody looks at your discharge summary and a discharge notice and all of that to make sure that you're aware of the contact numbers to contact if you are worried about something. If there is anything that you are unsure about, that there's a number that you can call, whether you or somebody else can call for you, to make sure that everything is clear enough when you get home. If you are in any rush to go home and therefore you are happy to go home before they give you your medications that you're supposed to take home, please make sure that you do send somebody back into the hospital to collect it for you, whether the next day or later on in that day. Because some patients would like to go home and the medication that they need to take home is taking a while for pharmacy to bring onto the ward. So you may choose to say, okay, I'm happy, I'll go home and I'll send my husband back, or I'll send my partner back in to come and collect these medications. Please make sure that you do come back and collect your medication, because these will be vital medications that you're going to need for pain relief, for things like anticoagulants that you may need to inject for the next 10 days or 6 weeks. Whatever that the prescription may be, you will need to come back and collect it. Okay, it's very important that you do this. But it's not going to stop them from letting you go home in most cases, unless they are, some sort of special medication that you need before, time is coming up for you to need it, then you can't go home and you have to wait for it, which in any case, they will tell you what the right decision to do, or what they will highly recommend that you do. Right, so I'm going to now move on to your first week at home, recovering from your cesarean section, okay? So when you first get home, you are going to be having a lot of discomfort. Hopefully you're going to stick to your your timings of your pain relief, and you're going to take it on time. You're not going to let this time lapse too much, and you're not going to miss any medication in order to help yourself with pain. When you go home, please, please, please try not to overdo anything, okay? Don't go home and go straight back to doing things like doing the washing up or trying to cook, or this might sound silly, but some people will try and do these things. You don't have to do that. You have to try and recover, okay? Cesarean sections are major operations. They're very common and they're done all over the world, and it is a big thing, you know. So please, please, please take your advice from your medical professionals very seriously, not to overdo anything, and to make sure that you're getting plenty of rest. As well as resting, you're still wanting to move about and still go up and down, and going to your bathroom, to the bed, or going from the kitchen to your living room. Try to mobilize as much as you can, but also balancing out, trying to get some rest, okay? If you're keeping good pain relief, you should be able to do all of this without too much of a discomfort. But if you let your medication wear off, then it's going to take you a long time for you to get back into your mode where your medication is now working. So please, please, please make sure that you are keeping up with your pain medication. You are not overdoing anything. You're going to take your time to go up and down your stairs. If possible, try and stay in a room where you have your toilets on the same level, you have maybe the kitchen on the same level, and anything that you need is really, really local and is all nearby. So you don't have to do too much walking, or you don't have to go too far if you don't have to. Okay, so if you can stay on the same level, then that will be really, really good for you. We will also encourage you to make sure that you are not lifting anything. I know it's going to be quite difficult to try to not lift up your toddler, especially when you've been away for 2 days and they haven't seen you for a while, you haven't seen them for a while, and you're really missing them. Try to do in a way that maybe you can get your toddler to be picked up by your partner to sit next to you, or to really gently come and cuddle you, and things like that. Don't do too much. Don't lift up your toddler, because this is going to be a bit dangerous to you and your cesarean section. So please, please don't lift anything or anyone heavy, such as your toddler. Okay, don't, try not to do that. Get them in a position where they can sit next to you so that you can do your cuddles, you can talk to them nicely, you can interact, you can give them some love and all of that, but try not to lift them up, because it's not good for you to do this. It's very, very important also that you are eating well. So when you get home, you may not have the appetite to eat as much, but the pain medications that you're going to be taking is most likely going to be very strong, and you need to take care that you're having enough food to help your liver to absorb these medications, and not to do any damage to your liver or anything like that. So please make sure that you are eating well. You are eating, even if you're not eating like, huge amounts, you're eating consistently and constantly, like, you're nibbling on stuff, and you want to eat things like really, really good, nutritious foods. Okay. So you're eating your soups, your stews, you're eating some carbohydrates. Try to get in there some fiber as well to help you with your bowels, and keep well hydrated. I can't stress enough how important it is to keep well hydrated, okay? Because if you are breastfeeding, your breast milk is 90% water. So you need to be drinking enough water to help you to stay hydrated, and for you to make more breast milk as well. It's also very important that you are eating well, so that you can give yourself some energy in order for your body to be able to make more breast milk. So if you're not eating enough, or you're not having the appetite, so therefore you're skipping meals or anything like that, this can affect your milk supply. Okay. The next thing to do is you want to try and get some rest. Okay. When I say rest, of course, you've just had a newborn baby. It's going to be hard for you to sleep, especially during the night. And coping with the sleep deprivation from the days before when you were in hospital, or if you were in labor for a long time before the cesarean section, you're most likely going to be very tired anyway and really sleep deprived. So try and get some rest. If this means getting your partner to just watch the baby for about 2 hours when baby's asleep, so that you can go and sleep, then please do this. Okay. Try and find a way for you and your partner to schedule some form of way where you can sleep and he can watch the baby, or he can sleep and then you can watch the baby. So it's like a tag team kind of game that you're going to have to do to help each other to make sure that you are getting enough rest, your partner's getting enough rest, and therefore when you need him the most, he's able to do the caring that you require of him. Okay, so please make sure that you are resting enough at home. In order for you to get good rest, it would depend on your pain relief. Okay, so if you are again not taking good pain relief, this is going to be very challenging for you. Okay, it's going to be very challenging to um to it's going to be very difficult. If you're in pain, you're not going to be doing much. And also, if you're in pain, you're not going to be able to rest. You're not going to be able to lie down, move yourself around, and all of that kind of thing. You're not going to be able to mobilize a lot. And it's just going to affect everything. Um, some people will worry that if I'm taking these painkillers or pain relief, is it going to affect, the breast milk that I'm making for baby? Is baby going to get some of the effects? But normally you want to, look at the risk factors of not taking pain relief to the risk of baby getting um, any bits of any medication that you might be taking. It is important that you are well managed in terms of your pain so that your body can do what it needs to do and recover, than to not be, comfortable because you don't want to have baby get a little bit of any medication going through your breast milk. So when you're recovering from cesarean section, you have to maintain good pain relief. I can't stress that enough, because this is a major operation. Like I said, your body's going through so much and is healing. Your body is trying to make milk, and baby's also really demanding, especially the first 5 days, with what they need. And so much of the feeding is mostly on you, so you need to try and maintain good pain relief. So please look at the risk factors and all of that and make sure that you balance things out. Okay. um the things that you need to look out for when you are in hospital, so when you go home, is to make sure that you are not, how can I say this? Uh, 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 um, the things to look out for that we do not want you to experience, such as excessive bleeding. We don't want you to have bleeding to a point where you're changing your pads like every hour. Okay, this is excessive. It's not normal, and you need to have some medical assistance. Okay. If you are also then, in terms of what things not to have, excessive bleeding, you are passing clots bigger than a 50p coin, like the size of this space, and you are not sure whether there's a clot, or is it something that you're not sure about, you're worried, please, you need to go in. Okay, you shouldn't, and I have to stress this enough, you shouldn't be feeling like you are worried, you're scared, you are unsure. At least you need to call up and find out. Okay, and this is why it's important that you know the numbers that you need to call, so when you get home, your partner can look at this folder and just see which numbers that they need to call if there's ever any emergency. If in doubt and it is an emergency, you need to just call either 999 or your, wherever you're watching me from, your emergency services number, and get some support to come home to you. Okay, so it's very important that you are not worried, you are not stressed, you are not in any way, shape, or emotionally drained because of pain, because of bleeding, because something that you're not sure about, anything at all to do with your vital signs not being right. You start to feel any palpitations, you start to get any headaches, like severe headaches. One of the side effects from epidural is for you to have severe headache. This is very rare, but if it was to happen, you will need to be in hospital for them to, sort this out. So anything at all that is not normal, please call up or go in to get checked out. Okay, there's nothing wrong with going back if you are experiencing severe pains, anything not normal to you or you're not sure about. It's very important that you go in and get seen to. Okay. Also, the things that you need to be aware of is that, when you are producing breast milk and your body's trying to produce breast milk, your baby's going to want to feed a lot. Okay, so it's going to be quite challenging when you can't move so much, you're in pain from having a cesarean section, and then your baby is constantly coming back and forth, especially during the night. Your baby's going to be very active between the hours of 2 a.m. and 5 a.m., no matter where you are, because your baby's programmed to demand more milk in order for you to produce more. So the colostrum that your baby's getting is what's going to help your baby to clear out his stomach from all the meconium and all the green and black poos. And then by day 5, your milk would have come in, and then your baby's then emptied out of all the dark colored poos and stools. And then now they're really, really empty. They're now ready to feed and get your breast milk supply going. Okay, so this is very, very normal. Another thing that when you are at home, you need to look out for is that you are able to pass wind. Now, when you're in hospital, they're not going to allow you to be discharged unless you can confirm that you've been able to pass wind. So you need to be able to break wind so that we know that everything is okay before you're discharged following your cesarean section. So when you go home, this is going to be a thing that you need to look out for as well, that you are still continuing to be able to break wind. This is absolutely normal, and it's very vital that you are able to do this. Okay, you might feel constipated quite a lot following a cesarean section, and the only thing that's going to really, really help you with that is if you are able to drink more water. You can drink some prune juice, you can drink some fruit juices. This is going to help your bowels to start moving and getting things out, and it will help you with the constipation. Remember, when you're pregnant, your body's digestion system is very slow, and this does not recover straight away following the birth. It's going to take some time to get back to normal. So you are still going to be very slow moving. Okay, so it's important that you drink water. This is why water also, again, is important that you are well hydrated, because this is going to help you. So please remember that constipation following your cesarean section is very normal. Most people will have this, this discomfort. You might be given some medication to help you to go toilet from hospital. You may not be given some. If you are not, it's fine. You just need to try and use some natural remedies, such as drinking, like I said, prune juice, eating more fiber in your diet, drinking lots and lots of water. Sometimes having a coffee in the morning on an empty stomach will help. Drinking apple juice or orange juice on an empty stomach will help your bowels to start moving for you to be able to pass some stools and give you some relief. Okay. I have to say, normal bleeding when you get home it's okay for you to be having bleeding. Okay, you're going to be bleeding following your cesarean section for up to 6 weeks. Definitely the first 2 weeks you're going to have some bleeding, and then after that, you're going to have some bleeding really intermittently, where you have some bleeding some days, and then some other days you don't have any bleeding at all. And then some days you go and you have more. Certainly, when you are breastfeeding, you will find that when you sit down and breastfeed for some time, you are going to have more bleeding. Okay, so your pad is going to be a bit more fuller when you are breastfeeding, because whenever you're breastfeeding, your uterus is contracting. So when it's contracting, it pushes out some of the blood, and this is very, very good. It's absolutely normal, and it's supposed to happen. Okay, so whilst you're breastfeeding, your uterus is going to contract. You're going to get a bit more blood. You can then also then experience some clotting when you go to the toilet next time. If you do go to the toilet and you see a clot, please make sure that you are passing a clot. A clot is very, very shiny, is very wobbly and jelly-like. If you were to touch it, it will break open. What is not normal is for you to pass anything that you think is a clot, but it doesn't look like it's like a clot. Okay, it's going to be a little bit meaty looking. It's going to be a little bit rough on the edges or rough all over it. This is something that you need to look out for, and make sure that you go back into hospital to get seen, or you are experience or calling in and just explaining what it is and what it is that you are seeing to a healthcare professional, so that they'll be able to know whether you need to go in to get seen, or if you need to be monitoring it a bit more at home. Okay, so it's very important that you are monitoring the bleeding that you're getting. If you're getting any clots, that you are making sure that they are clots. You should not be having bleeding to a point where it's soaking through your clothes, it's soaking on your bed, you're changing your pad every hour. This is not normal, is excessive bleeding, and it can be quite dangerous. So you will need to seek help for that. Okay, you need to go in and get seen and get reviewed by a doctor or a midwife. So please, definitely, we are not expecting you to have any heavy bleeding. The most you'll be changing your pad will be maybe every 3 hours. And even when you go to change your pad, it's not absolutely soaking from head to toe. Okay, it's going to be fill, but you can then change it and it's not anything leaking down your legs or anything at all like that. Okay. The other thing that you also need to make sure that you're not doing is also going to drive. So normally you're not meant to drive for at least 6 weeks following your cesarean section. Try not to break this rule, okay? Because number one, a lot of people don't know this, but your insurance doesn't actually cover you following a cesarean section for 6 weeks. So do not drive. And also, if you are driving and there's any accidents, the trauma of accidents, you being a driver, even if there is no injury, you might panic. There's a lot more going into it. So please try not to drive. Get somebody to drive you, or take a taxi, or get somebody to come and, pick you up, or Uber, or anything like that to get to any of your hospital appointments or anywhere that you must get to. Okay. So try not to drive at all. If you can resist. It's really, really important that you don't drive. Legally, you're not meant to drive, and also just physically is really not advisable for you to drive. Okay. Please, if you are liking this live, then please subscribe to the channel, and also um leave me some comments if you have any questions as we go along, and support the live or support my channel. It would be really, really grateful if you can share the live to other people that you think will have some um information from this as well. Another thing that I have to go through is the emotional side of a cesarean section. Recovering from cesarean section is very, very emotional. It can be quite, draining, quite it is I mean, giving birth and following the birth is all quite emotional anyway. Your hormones are going to start to go down. Okay, so you're going to be experiencing, from about day 3 following your cesarean section, you're going to be experiencing baby blues. um Baby blues is normal, is very common. A lot of women will experience this. A small number of women will feel like, oh, I didn't feel any baby blues, but when they look back, they'll think, oh, actually, I did feel a little bit like teary, or a little bit low, and I don't know why I did feel like that. But it's very common. Baby blues is where your hormones are going down, so you are going to feel really, really emotional. You can even look at your baby and feel so much love for your baby that you're going to cry. Sometimes you cry for no reason. Your partner may tell you, oh, I love you so much, and look at this beautiful baby, and then you start to cry. You may be watching TV and then you start to cry for whatever reason. You're not sure. Best way to get through this is to make sure that you are communicating how you're feeling to somebody else, okay? Because normally it's worse in your head than in what it really is outside. So if you're feeling emotional, you're feeling like you're a bit, teary, speak up. It's absolutely normal. And if you have good support and people that can support you, if you're a partner watching this, make sure that you look out for these signs and you are supporting your partner when they are feeling like this. Okay, so don't ignore it. You have to acknowledge that you are feeling how you're feeling. It is normal and it's okay to feel how you're feeling. Just speak up and you'll get the reassurance you need from your loved ones around you, and then you'll be able to overcome it. Okay, it doesn't last for very long for most part, maybe from day 3, day 4, and then you find that it's getting better by day 5, and then you may experience it again, and then you think, okay, I think I'm okay. Like, it's very, very quick, but it is noticeable, especially by you, the mother that's given birth. Okay, so it's very, very okay. It's normal. Please speak up if you are feeling any way like this. Okay. um it's also going to make you feel really overwhelmed, and that's one of the major reasons why people will cry, is that they feel like it's so overwhelming with having a newborn. This baby is relying on you for everything. You're feeling like you haven't slept enough. Are you going to do this job right? Are you a good mom? Are you a good person? Am I doing enough? I'm not doing enough, or I'm doing too much. And then also, when you have another child where you feel like you're not giving so much of your time as you used to, that can bring on some guilty feelings as well. Please remember, this is absolutely normal. Don't feel guilty. It's easier said than done. But when you are there going through it, just think that, when you brought that baby home, you were doing exactly what you're doing for the second baby, or this third baby, or this fourth baby, or whichever number baby, you were doing the same thing. So it's okay for you to give this attention to this newborn right now. And then later on, you go back to your toddler which their feelings doesn't, it does matter to them, but they're not going to hold it against you. They're going to forget it very quickly, and they're just going to be more, immersed into the new family dynamics and things like that. So don't take it too much to heart. Don't let it stop you from doing what you're meant to do in terms of bonding with your newborn baby, and also trying to involve your other children or your toddler, whoever else that you have around you that you feel you're neglecting. Involve them as much as you can, but of course your priority right now is to this newborn baby, and everybody will understand there's nothing that you're doing wrong, and please rest assured that it's okay. Okay. um when it comes to getting over baby blues as well, one thing that you can also do is to make sure that you are continuing to do skin to skin contact with your baby, and you are bonding as much as you can with baby. Have baby on your skin as much as you possibly can. It doesn't have to be just you. Your partner can also do it. And the fact that you see your partner doing skin to skin can sometimes make you feel really, really lovely and really, well looked after, like everything is going well. You feel the bonding of the whole family coming together. If it is your first baby, it's going to be a great experience for your partner to also do skin to skin, and for you to watch them bond as well is a really great feeling. So please make sure that it's okay that you are either doing skin to skin or your partner is doing skin to skin. It's not just done in hospital. When you get home, continue doing skin to skin as much as you can, for as long as you can. So definitely keep skin to skin going. Okay. It's very important that you keep doing this. um Another thing that you need to look out for is that you want to still try and do your pelvic floor exercises. Now, following a cesarean section, two things that we definitely say you should not do is to start doing any exercises, or you should start doing any bathing in a tub. Okay, so we don't want you to go into a bathtub and have like a soaking bubble bath or a bath in a bathtub, because we don't want you to be laying in a bath and then given any bacterial chances to grow in the areas of your cesarean section. So this is just to help avoid any infection. Okay, so we also don't want you to do any exercises such as going. I mean, you will not want to do that anyway. Okay, but we don't want you to do or even think about, I'm going to exercise my stomach, or I'm going to exercise my body. None of that really matters right now. All that matters is that you're recovering, you're bonding with your baby, you're establishing breastfeeding, you are getting to know your baby's getting to know you, and you are just enjoying the experience in the moment. Okay, you're living within that moment. So please don't do any exercises yet. The only exercise that we do recommend that you do is try and feel sometimes for your pelvic floor muscle, to try to exercise that. Okay, this is what I think is known in America as the Kegels. So please, we want you to try and feel with your bladder, your pelvic floor muscles, and also that you're keeping an eye on your bladder work. So you are feeling the sensation of needing to urinate. When you go to urinate, you feel like you've passed all the urine and everything is empty, and you're feeling like you're not having to rush to the toilet. You're not having any accidents before you get to the toilet, you're passing urine, or when you start to pass urine, you're not sure whether you finish and you stand up and you pass more urine. Anything like that, please, again, these are all things that you shouldn't be experiencing. Okay, your bladder work should still be working absolutely normal. You should feel the need to pass. You should go to the toilet and pass and feel emptied. Okay, you wipe, you get up, and there's nothing else coming, and that's what we are expecting you to be feeling and experiencing. So anything apart from that is really not something that to just ignore. You have to get some advice and some care from your healthcare professionals. um Going back to the emotional aspect of your cesarean section, please, 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 it's important that you have somebody that you can talk to when it comes to your emotional well-being. It's very vital that you feel like you can express yourself. You can, say anything that you're feeling, and you're not feeling like there's something wrong, or you are being too much, or you're demanding too much, or you must do it yourself, or you're going to be okay, you're a strong person. Of course you are, but at this moment in time is a very vulnerable part in your journey of having this new baby, and therefore it's okay to ask for help, to talk to friends, talk to your partner, talk to anybody that you feel confident and comfortable to talk to. And you are also looking after, this is all part of looking after yourself, and your mental health comes to, it's at the top of looking after yourself. So please make sure that you are communicating with people. Try not to isolate yourself too much, such as, when you wake up and you want to just stay in your room with the baby because, you don't feel like really, really assess your mental health, like really consider how you're feeling. And if you're not sure if it's right, like you should be feeling like that, ask questions, tell people, I'm feeling like this, is this okay? And remember, the professionals are going to be along the way with you. You're going to be having visits from health professionals. Do speak up to them, and we will try and support you as much as we can when it comes to your mental health. It's one of the most important things to us as well. Okay. Um, and then, of course, when it comes to self care, we want you to make sure that you are, again, eating well is part of your self care. Maintaining good pain relief is part of your self care. Speaking to people, telling them how you're feeling about things emotionally is part of your self care. You are taking yourself to you are doing things in the house, things like maybe even putting on your radio if that's what you used to normally listen to. Put on the TV in the background, put on your favorite shows in the background, that things are happening around you. Don't isolate yourself, don't just let it be just baby, and you have to try and also have your own life as well. And still talk to your partner as you did before, like still carry on with yourself, because you are also very, very important. In fact, you are the main person in this, that you have to be all right first, and then everybody else will be fine. So if you're okay, your baby is going to be absolutely fine. Okay. If you're not well, your baby is going to get effect of that. So please make sure that you are maintaining your self-care as well. You're looking after yourself, you're eating well, you're drinking, you're taking painkillers, you are emotionally well, and you're connecting with people, you're talking to people, and you're not isolating yourself. Okay. So in terms of the C-section, make sure that you are keeping the area clean. At some point, your healthcare professional will come home. They will advise you to either, from hospital, to either take the dressing off the wound, or when the health professional comes home to see you, they're going to remove the dressing for you. They'll check that there's no stitches to be removed. Normally, cesarean sections are done with either a glue or dissolvable sutures, so nothing needs to be removed following the time that you go home. It's just the dressing that needs to come off. Once you get home and you have your shower, the dressing can be removed either by yourself or the healthcare professional that comes to visit you, and they'll remove the dressing to make sure everything underneath is doing well. You are going to have some pain in the area, some hardness, some swelling, some redness, and this is absolutely normal. What we don't want you to have is a really, really bad offensive smell in your wound area. We do not want you to have any bleeding from the wound area. We don't want you to have any oozing, any pus coming out, or anything that does not look normal. It's okay to have some redness, some swelling, some bruising even. That's all fine. This area, you must work hard to make sure that it's absolutely dry at all times. The trick that I'll give you is that once you've had a bath, not having a bathtub, okay, so maybe just a shower. Once you've done that, make sure that the area is absolutely dry. So you're going to damp it dry, you're going to pat it dry with your towel. And then the other thing that you can do, which is a good trick, is that if you can get a hair dryer, like what you dry your hair with, put it on your cold setting and just use that to blow dry the area. Okay. Especially if you have any excess skin that covers up the cesarean section, please lie down back and get air to the area and dry it. Okay. As much as you can, keep the cesarean section wound dry, because this is what is going to prevent you from catching any infection or for any bacteria growing, because bacteria grows in damp areas. So try not to make this area be wet or damp. As much as you can, get air to it. What can also help is that you get some really big cotton underwear. So wear some cotton underwear that you can pull up all the way up to your belly button. So the underwear that you're wearing needs to be at least 2 sizes bigger than you. Okay, so when you're shopping, shop for bigger underwear. So two sizes bigger than you, and then it's going to be cotton as well, so it can be breathable. It will get air into it. Okay, and then, of course, you're going to have your pad on. Make sure that you're keeping the area clean and neat. Have your bath as usual, dry the area, keep it dry. If there's any offensive smell, any pus, any oozing, any bleeding, anything where you feel is not normal, please get seen. Okay? It's important that you get seen and that we make sure that there's no infection going on, because if there is an infection, we can do something about it. We can give you antibiotics, and this is going to help to take it away, to cure it, and not to make anything worse, because you still have your baby that you're looking after. So like I said, you come first. If there's a problem with you, it's going to trickle down to your baby, and it's going to possibly hinder the care that you're giving to your baby as well, and we don't want that. So make sure that you are looking after yourself, following your cesarean section, and if there's any concerns, you're going to come back in or call up or get seen to make sure that everything is getting resolved and everything is okay. All right. Your cesarean section is going to take some time to heal. The first 2 weeks is going to be quite sore, very painful, but it's going to get gradually better each day. Okay. The first 5 days is definitely the hardest because you've got that to deal with, as well as trying to establish breastfeeding. So it's very difficult. But by the time you get to about day 14, which is 2 weeks into it, you're going to feel really, really well. You're going to feel okay. There are still times where if you overdo something, like go for a long walk, or you're out and about for too long and without maintaining pain relief, or you're not taking any things like paracetamol for anything, you will feel like you're a little bit, sore. And this is normal. So up to 6 weeks, we don't want you to drive. We don't want you to put on any bands as well, like any compression belts that to suppress your stomach. Please wait for your uterus to go down first before you start to use these tummy belts and stomach compressors and things like that. Okay, following your cesarean section. We don't want you to drive in the first 6 weeks. So it's very, very important that you are really taking the advice that is given to you and you are following it very, very carefully, because it's going to help you to recover well and to recover fast. Okay. We always say that recovery for your cesarean section is going to take at least 1 year for it to heal, because remember, apart from the section sutures on the outside of your skin, there's also other layers on the internal that needs to also heal. So we always say at least a year for you to have a full healing of your cesarean sections operation. And this is why you are normally recommended not to have a baby within the first year, or not to get pregnant again within the first year of having a cesarean section. We always say you have to wait at least a year and a half to 2 years, and just give your body time to recover, to heal properly, externally as well as internally, or most importantly, internally. Okay. So please, if there is any issues following your cesarean section, as I've mentioned in this live, make sure that you are getting support and you're getting help with that. Okay. I hope this live was helpful to you. If you haven't subscribed to the channel, please subscribe. And if you find this information useful, then please, again, subscribe to the channel, like the channel, explore my page. I've got lots and lots of videos for you to watch, and that's going to help you with during your pregnancy, birth, and after as well. So please, please look through the channel and just find something that you may be looking for, or you have been asking yourself about and you're not sure about as well. The next time I'll be coming live will be this Friday at 9 p.m. UK time. So I'll be coming live again on Friday. In that live, I'll be discussing about how your body will change during pregnancy. Okay, so a lot of people are aware that your body is going to change in terms of the physical and things like that, but I'm going to go into details into how much your body is going to change in terms of the medical ways and things like that, and things that you can do to help yourself prevent some things that you may be worrying about. And if you have any questions, you can always ask it as well during the live. Thank you so much for watching, everybody. And once this live is done, I'm going to post it again as a video. If you didn't see it all, you can come back and watch it and take parts that you want to watch or anything like that as well. Thank you so much. Have a lovely, lovely day and a lovely evening wherever you may be. And I'll see you again in the next live. Take care. Thank you so much. Bye. Bernard.